These are the images of last week's picture quiz. 3 images were provided. One was a gross appearance and there was 2 microscopic images. So before we discuss the diagnosis, let me share the most common responses. The most common diagnosis was squamous cell carcinoma. The others were CHROMOBLASTOMYCOSIS, basal cell carcinoma and granulomatous lesions like leprosy, lupus vulgaris, etc. As you can see, there are polar opposite diagnoses in this case. So at one end you have malignancies like squamous cell carcinoma and basal cell carcinoma, which are malignancies of the skin. At the other end of the pole you have benign non-neoplastic conditions like CHROMOBLASTOMYCOSIS and granulomatous infections. Now let's move on to discussing the pictures. The first picture was a gross image of a lesion on the limb. So there is an ulcer proliferative lesion, the predominant part of it being an ulcer at the central portion. At the periphery you can see that there is an irregular proliferative growth. And there is some pigmented areas on this particular growth, but it could be hemocydrin deposits from a hemorrhage or it could be melanin pigment from the skin. At this point it's difficult to say. This was a scanner view of the microscopy of this lesion. So for those of you who haven't understood, this is a skin biopsy and it shows the epidermis and a part of the superficial dermis. These pinkish areas are the part of the superficial dermis, which are the dermal collagen. At the center you have the lesion proper, and flanking it you have epidermis, which shows some degree of hyperplasia, which we call acanthosis. So acanthosis is a hyperplasia of the epidermis with elongation of the retail ridges. There is some hyperkeratosis as well. In the superficial part of this lesion there is some ulceration or denudation with some keratin debris. Let's talk about the lesion itself. It appears to have an infiltrative margin. So at the periphery you can see that it appears to be infiltrative, and just peripheral to that you can see that there is a haziness, which is actually an inflammatory infiltrate, which at this part it's difficult to say what kind of an inflammatory infiltrate it is. Now the question is if this is a malignant proliferation or if it's a benign proliferation. If it's a malignant proliferation, it has to be a squamous cell carcinoma, because this appears to be an infiltrative growth of the epidermal keratinocytes. So a malignancy would be a squamous cell carcinoma or a well differentiated type of squamous cell carcinoma. If it's a benign lesion, is there a benign proliferation that can mimic a squamous cell carcinoma? Yes, this is what we call pseudoepitheliomatous hyperplasia. Pseudoepitheliomatous hyperplasia is a benign proliferation of the epidermis which mimics a squamous cell carcinoma. So it's difficult to differentiate between a squamous cell carcinoma and pseudoepitheliomatous hyperplasia, especially a well differentiated squamous cell carcinoma, because they usually don't show much degree of atypia. However, the formation of keratin pearls, keratin whorls are all classical of a well differentiated squamous cell carcinoma. However, here we do not see that picture. These are some of the conditions where a pseudoepitheliomatous reactive hyperplasia of the epidermis can be seen: granular cell tumor, fungal infection, Spitz nevus, keratoacanthoma, granulomatosis with polyangiitis, which was earlier called vaginismus. These are only few of the conditions which is associated with this particular type of hyperplasia. Moving on to the high part. This was taken from the periphery of the lesion, because on the right you can make out the dermal collagen and on the left is the lesion proper. So at the junction of the lesion and the dermis, and even inside the dermis, even within the lesion, you can see that there is definitely an inflammatory infiltrate composed of collections or micro abscesses of neutrophils and also granulomatous inflammation. So composed of these epithelioid histiocytes, and you can even make out Langerhans type of giants. So this granulomatous inflammation may have led most of you to think of a diagnosis of a granulomatous inflammation consistent with lupus vulgaris or a leprosy, which in this image image would probably be a tuberculoid type of leprosy. However, the finding of neutrophilic collections is not classically seen with this said lesion. So when you see neutrophilic collections along with a granulomatous proliferation, you should always think of a fungal infection. In this field, some of you have been able to make out the fungus. Some of you must have thought it is artifactual. So these rounded or spherical bodies which has a brownish tinge, these were the fungi in this particular image. You can see some of these organisms within the multinucleated Langerhans type of giant cells as well. The circle red are the representative of the fungal bodies. So these bodies are also called sclerotic bodies, and for those of you who diagnose this as chromoblastomycosis, you are absolutely right. In this particular case, we had these findings: pseudoepitheliomatous hyperplasia, neutrophilic collections and granulata, multinucleated giant cells, some of which even showed these fungal bodies. And these fungal bodies are also called sclerotic bodies or medulla bodies after the scientists who contributed to the identification of these organisms. A brief note about chromoblastomycosis: these are also called dematiaceous fungi. Dematiaceous meaning pigmented. So these organisms have melanin pigment in them, which is what renders them the brown color. Some of the organisms that are associated with this condition are Fonsecaceae pedrosae, Phyllophora verrucosae, Fonsecaceae compacta, etc. And Fonsecaceae pedrosae is one of the most common cause of chromoblastomycosis in our country. This infection is more common in the tropics and subtropics, and the point of entry is usually a traumatic injury. So this infection is more common among agricultural workers, which may be an indicative clinical history in these cases. As you can see, gross appearance of this lesion can vary from a plaque-like lesion to a cauliflower growth which appears like a squamous cell carcinoma. So my take-home message from this particular picture quiz is that an appearance of such an appearance of a verrucous or a cauliflower growth should not directly make you think of a malignancy alone. You should also think of other benign conditions that may mimic this kind of appearance. Thank you.